We've identified a new asbestos-related disease, and we're figuring out ways to avoid it.
Her story lives on in each and every one of you.
Firefighters that have lost their lives, that have really put everything on the line. I'd like to start with, I represent about 300,000 career firefighters across the United States and Canada. I'm a former firefighter, not too far from here. I grew up in the DC area. I have three brothers. My dad was a police officer, and you did a fantastic job, unbelievable job. You really did. And I have the honor right now. I retired, so I work for health and safety for the International Association of Firefighters. That is my description and my job duties now since I've retired from being an active firefighter. And I would just like to start. I mean, we've heard a lot of stories today from a lot of people, the advocates, the people that are doing some amazing things in some other countries, those that have lost a loved one, and those that are living with the condition today and fighting it every day. We have some words that we use in the fire service. You know, for what we have is our, those firefighters that have lost their lives, that have really put everything on the line. You know, and we have a family ring around our memorial, and it's, it says in these little words, it's family sacrifice, it's honor, it's community, it's courage, and it's strength. And that's how we look at the fire service. I can not think of any other way than looking at the people that have spoken and those people that have talked up here, using the same words in what you are doing every day. It is incredible, and I really appreciate that. That's fine. Thank you. I met Linda, I guess Linda 11 years ago. I guess that's when it was, because this is your 11th, and it was the first year. And Doug and little Emily was running around. And the other area, too, was, which is probably my biggest impact, was meeting Alan, her husband. And when I met Alan, Alan wasn't really manifesting those signs. He was still pretty strong. He was still, talking. And what really hit me when the words came back to D.C. from California, that he had passed. That's when, I couldn't, comprehend that. We knew that was possibly going to happen, but when you hear about it, you don't think it's going to happen, and it did. So my hat's off to Linda and Doug and really putting this thing together and going forward. I'm just going to go through a couple things here quick, and even in the slides and even in some of the information that we have. And I want to tell you, in the fire service, what's being affected, what has just recently happened. You think we would have had this information before, you think we would have been well ahead of the curve, but we're not. And in some of the information, even the information I've heard today, that we even have some information that we have to change. But we really, for the firefighters, I have a list here of the building construction, and too often, with anything that we deal with, complacency is another killer. It's kind of equal to the prevention. You don't think it's going to happen to you, it's going to happen to somebody else. This is not going to, you hear about it, but until it really affects your family, someone close by, or yourself, you realize that the exposure to a lot of different things, especially in the fire service, can kill us, and that we have to be aware about that, and we have to do more on the prevention side. We know, where asbestos fibers are coming from. You just heard Mark talk about, the union that really has to deal with this stuff on an everyday basis. That's in a controlled environment. We're in an uncontrolled environment when we go into our workplace. And that uncontrolled environment, in a lot of times, we don't know what we're being exposed to and how long we're being exposed to and what types of exposure. And just recently, I'm going to go through some studies, and I think it's real important, because for us to get the protection and to really get the message out there and the awareness out there, you need the data too to show what is actually taking place, what is actually happening, and I really want to kind of talk about that. We do know, when you go, our typical fire is in a kitchen. It's not a big deal. Those are a lot of fires that we do, and when we go in there, it might be a small fire, and we have to do what we call overhaul. We have to go in there and we have to make sure that fire is out. And in that process, after we've taken our SCBA off, we actually breathe in a lot of toxins that we shouldn't be breathing in. And we have an issue in the fire service, and we're trying to face it. Our SCBA is very, very heavy. It's only got about, depending upon the bottle, we've got about 30 minutes of working air that we can do the job. And when you're doing that, you have about 75 pounds of that gear on. The first thing you want to do is take off that SCBA, and then you can actually, feel a little bit of comfort from that. But it is that time that we're seeing that we're getting a lot of our exposures, and we're getting them in a way that firefighters don't realize that they have to be careful about that, and they have to make sure. So. We got it. There are a couple things here that, just real quickly, that we have here, and inhalation is one that if you look at, I'm going to talk about another study, but that is one where our lung cancers are down. I mean, they are decreasing in lung cancers, but I'm going to mention something that really was a surprise to us. Skin absorption is a big area that we're having to face right now, is that you have that protective gear on, but all that soot and stuff is coming up through that gear, laying on your skin, and it's actually going through the pores of our skin in ways that, and you vasodilate, you're very, very, everything is open because your body's trying to cool off as a firefighter in there. And that vasodilation, the moist environment, the gear itself being compacted to the skin, we're looking at the studies and we're looking at, is that an area that we really have to concentrate on? And then ingestion that we know we have. This one here, I just wanted to put this one up, and you heard words today that permissible, there's not, that word has to be taken out. I mean, what we had, I spent 2.5 months up in New York right after FDNY, working with the FDN Fire Department, and we had our command center up on 56th Street, and anybody that walked by you knew that they had been working down at the World Trade Center because of the smell that they carried. And we were very, very concerned with the level of what were the levels down there, what were the firefighters breathing in, what were all the first responders, and it just wasn't the firefighters. We had police officers, we had volunteers, we had the firefighters, we had some of the trade workers that were doing an amazing job helping us remove heavy debris, trying to do search and rescue. But all of that, and I remember quite distinctly, I have the piece of paper that actually said that, EPA said that we were at safe levels, so I mean, that's, that will always resonate. And the EPA chair at that time, Whitman, there was we were getting a meeting just recently that she was going to be at, and I told them that the IFF would not be participating in that meeting. Because of that single event there, and that is never going to be forgotten, nor will it ever be forgiven in some cases, because they did know and they chose to do the wrong thing at that time. We have plenty of documents coming out. We have NIOSH has just come out. We've had health hazards. We have UL. Everybody is coming out now with, the information that we know as firefighters of what are we being harmed with, what are those chemicals in there, how are we being measured. Here's the problem that we have, and this is a typical firefighter in an environment. And what we have is, when you're protected and you have your mask on, you are being protected from some of those elements. The other ones I said through absorption were not. That little meter beside there is a meter that is a CO meter, and in a lot of cases what has been happening is they'll set that up in a house, and then they'll say when the levels of the CO get to a certain level that you can remove all your breathing apparatus. This is another area of correction that has to be happening in the fire service that we should be doing, not only the firefighting, but then the overhaul with full SCBA. We have not found a substitute. We've tried to use even dust masks. You tried to use some other masks that we have that can work in some environments. We realize right now that if we don't stick with our SCBA, that the chances are that we are going to contaminate ourselves. And again, you have young firefighters coming in. I was a young firefighter. I was dumb, I was stupid, but a lot of times I was following the orders of the person in front of me who was supposed to be a supervisor and was supposed to be a leader. And you never wanted to think that you were afraid of anything, so you follow those examples. And I can tell you right now that sometimes those are the worst examples that you can follow, because those are the leaders that are supposed to be really protecting the workers at that period of time. So we're really hitting that area too, that, you know, and this crosses into a lot of occupations that is not something that you want to manifest itself in ways that continue. You heard early on, and this was a real shock to us. This was something that NIOSH, and I have been battling with NIOSH for over, you know, probably 15 years, and Dr. Tom Hales, who did the study for us on cancer, I said, you know, Tom, we have more firefighters dying of cancer than we do that you're recognizing that are dying, you know, of in the line of duty and with heart disease. And heart disease is a big, huge area. We lose a lot of firefighters on the fire ground from heart attacks. And we've had that running argument. Well, they actually did the study, and we found out some amazing things. And we did not know the asbestos issue that we had in the fire service. This just can't, we did not know the magnitude. We knew it was there. We knew that it was there, and I'll go into that in just a second. And then the second study, a Nordic study, followed up, and it did this. It almost duplicated what the NIOSH study was doing, and even in higher percentage of asbestos-related diseases. And then all of a sudden we said, you know, what is this? Why didn't we know this ahead of time? Those studies that we had, just real quick, NIOSH, that was the study, the Nordic study. We have an Australian study that just got completed, and we really don't have all the results from that, a Korean study. And Grace LeMaster's was a meta-analysis about 32 different studies. And LeMaster's study was always used and touted as our cancer study. So we have presumption in a lot of states, and that's what we fight for legally. And presumption is that there are certain cancers that we have identified truly related to the job of firefighting, that we are given some sort of presumption, or at least in the case of law, when you have presumption on your side, the employer has to come back and say that, no, you didn't get it from your job, you got it from someplace else. That burden of proof is incredibly important for anybody going into the court of law, trying to get protection and try to get compensation. So all of these studies were there, but it wasn't until NIOSH and the Nordic study came out that all of a sudden we realized that the cancers that we needed to put on that list, some of those cancers were not there. Just jumping real quick into the NIOSH study. It was one of the largest studies, about 30,000 career firefighters. We looked at Chicago, Philadelphia, and San Francisco. And those are, you know, if you look at that, and you just heard, you know, about Chicago, those buildings and how old they are. And at the first time, we went all the way back with that study, and we kind of took a look at let me just change this here too. But what we were able to look at were the death certificates. We hadn't done that before. We hadn't gone back. We went back to the 1950s, and that's not how we were looking at cancer. We were looking at those cancers of firefighters that had recently retired and had died. And now all of a sudden we went back and looked at the death certificates and what spotlighted. You can imagine what all of a sudden we saw that we didn't realize we had. That we had an asbestos issue problem with exposures that we did not know really existed. And we do know, and a lot of you, and it's been said in here time and time again this morning, the latency period on that. Normally a firefighter will get to work in his 20s, and then he'll retire in his early 50s just because of the nature of the job. So they were leaving, and we were not tracking that. We were not finding that. We were not doing that. And we have to do a much better job of not only tracking that, but making sure that we get that information out to the firefighters. This is the firefighters. The next part of this study that we're really going to do that's interesting for us is that we've gotten those cancers. Now we're going to overlay that with the exposure. And the exposure is, where did the firefighter work? What position did he work? How many hours did he spend in a fire? How many fires were in that given area? How long were they in those fires? What were the exposures in those fires? So now we're going to be able to take a look at, and we're even going to be able to drill down even further than we have done in the past. Again, this was the Nordic study. These are just some of the numbers. This is something else that we had to look at. People were not believing. Thank you. I got my warning. So this is the Nordic study that we had. The Australian study that came out, here are some other numbers with the Australian study. This is, exposure classification for us. It's, we have a healthy worker syndrome, and I'll try to get into this right away. 9/11, right now we have 3,900 cancers related to 9/11 first responders, 3,900. We have 92 firefighters that have died since 9/11 in a direct relationship to that. The thing for us that is really, really, one of the most important things on the preventable side is that if we did not have baseline medicals in those firefighters in New York City, we would have missed something that was extremely important. And the baseline was that we had pulmonary function tests, and that's just when you blow in and you find, a lot of us know what that is and the capacity. We knew Dr. Berzant, who did some amazing work in New York City. We realized just 4 months later that we were going to have we had a catastrophic event here, and now it was just going to be time to prove that event was going to take place, and that event has taken place. We were just in Congress this week fighting for the World Trade Center health protections, compensation, and to try to make that permanent, and that keeps changing. And with the advocacy that this group does, I don't have to explain how difficult that is. But it's painful. We're not going to go away. We're going to make sure that we stay on track on that. Just real quickly, I'm going to end with just 2 slides here. One is that for prevention, what we have to do is our gear. When we go in and we bring our gear back, we did not know the exposure. We're doing dust studies right now inside the apparatus, and we're actually doing a study with University Cal Berkeley in California, 5 different fire departments, 5 different stations. We're really looking at the vacuum cleaner bags. We're actually taking those and we're going back to the lab and looking at what are the particulates in those vacuum cleaner bags that firefighters are bringing back from the call back into the firehouse. And we already have some preliminary data on that shows that we have to do a much better job in that cross-contamination, even in our apparatus. And then the next part that was so difficult for me to hear, when you go home, are we contaminating? You're bringing that fire gear, you're bringing it in a bag, it's not being contained, you're putting it in your trunk. Your small child is in that car too, and what kind of secondary exposures are we doing? And we're really, really concerned with that. So we're really taking a look at those things. And that is really in conjunction with what we have here with at the firehouse. Looking at the fire contamination, and even dealing with our living quarters. We used to take our fire gear and put it right next to our bunks there, so when you had the call, you get on your gear and you could just take off. So it's amazing the things that we still have to do on the prevention side. I'm going to just close again that, there's one thing when you have a loss of a loved one. There's another thing when you come down with cancer itself. But there's another thing that there's no substitute for what needs to get done, and that is the challenge that is ahead, that you don't take that and say that that's it, that's all I'm going to do. You take that challenge and say, I am going to do something. I'm going to make a stop to this. And I can tell you right now, I've been doing this for a long time, and it's small organizations, it's small individuals, it's people that really have that passion and commitment, that they're saying, hey, nothing is too big for us to stop our voices. And the voices have to be heard. And, we don't know the collective, when does that happen? When does the miracle happen when something changes because somebody finally listens? Or when do you get a bill passed? We know that it's about money. We know that it's about votes. We know that those things. But when you put a face to it, when you put that passion to it, there are amazing things that people can do. And I applaud not only this organization, but everybody in this room that's going to continue to do it. Because what you're going to do is you're going to save lives of people that don't know their lives are going to be saved. And you will do that. You'll have a part of that, and you'll have a part of us.